Hello, everyone. This is Doug Nelson, the president of BodyWork Associates. And in this video, I want to go over just a few things about one of the most common conditions we see, which is that of heel pain. This is an important condition that people struggle with because if you look nationally, I mean, the economic cost is not insignificant, somewhere between $200 and $300 million annually. This data is 10 years old. It's from 2010. And in many ways, what I've heard is that plantar pain is kind of, somebody actually called it the new back pain, which means that it is becoming more and more prevalent and more people are struggling with this and don't really know what to do. You know, it's also very interesting that if you look at this, it's $376 million annually, but the bulk of that cost, 80% of it, is for, due to medication, because really for kind of traditional healthcare, they don't know what else to do. And so medication is the primary source of treatment. So that's a bit discouraging, especially if you're the person who struggles with this. But we feel like we at the office have something to offer this, and there's good research data behind it. Everything that we do is both from our clinical experience. The office has been in Champaign since 1982, and we see thousands of people. And so there's that, but also we're very much into the research aspect of the world, and the research data behind manual therapy approaches and foot pain is quite good, actually. So just to point out a couple of things, this is the plantar aponeurosis, what's called the plantar fascia. So it's like that band. So if you think of the arch of the foot, here's the arch, this bone called the navicular is kind of the keystone of the arch, but it's then supported underneath by this band of thick connective tissue, which is the plantar fascia, or more technically the plantar aponeurosis. Here's another picture of that looking from the bottom, and you see how this connects to the heel and then has individual slips that go to each toe. So like in the last picture, as you think about the weight coming down this way, this is a good part of what supports the arch. So anything that stresses the arch, of course, is going to stress the plantar aponeurosis. Now, you'll notice that in titling this video and that we didn't call it plantar fasciitis. That's an important thing. There are many reasons that you can have heel pain. Plantar fasciitis is just one of those. So really, I know this seems a little simplistic, but really what people are trying to do now, people meaning the research world and clinicians are trying to say, just call it heel pain. So heel pain syndrome. Of that, problems with the plantar fascia itself could be under two different headings. One could be plantar fasciitis, the more traditional thing that we think of, and the other one is plantar fasciosis, which we'll get to in just a second. That's important because when you name it, you frame it. If you call it fasciitis, by definition, you're saying it's an inflammatory process, so you're going to use anti-inflammatory approaches. But if it's not an inflammation, all those anti-inflammatory approaches won't work. What's worse is what's good for one is actually kind of contraindicated for the other. So it matters what you call things, because then from that's how you end up treating it. That may be a problem. So the typical symptoms of plantar fasciitis: pain in the morning. The first few steps are usually the worst, those first steps getting out of bed. The pain pattern is typical for what you see over here, actually on the right. And also this occurs after prolonged inactivity as well. So if you're sitting at your desk for a couple hours and then you get up, it's not uncommon for people to have pain then. And also for many people, just prolonged activity. If they have to go for a long walk or stand for a long period of time, that can be problematic. What are the risk factors? Sports or physical exercise, yes, but almost more important than that, the kind of more recent data is that if you dramatically increase your physical activity over a period of time, running, there's often the 10% rule that you don't increase your mileage more than 10% a week. So people who decide, being overweight is certainly a risk factor, age, gender, females, it's a little bit female biased. So again, you can imagine that person who decides, I am going to do something this year. I'm going to, do something about my weight. And then they dramatically increase their physical activity much too quickly. And now they end up how frustrating with plantar fasciitis. So all these things are risk factors. The most important one being an increase in activity, at a spiked level. Here's a very like an ultrasound image of the plantar fascia itself, and this is circled because this is thickened. The more stress the fascia is under, the more that fascia will thicken, and this is actually one way to really diagnose this very clearly. But doing this kind of image or an MRI is actually quite expensive, and most people aren't going to have access to that. And honestly, you don't really need to do that. But in the research world, people with the most symptoms have the thickest fascia. So anything over about like 3 millimeters or so is problematic. And it shows that that tissue has been under duress. And in the body, anything that's stressed for a period of time will then build up in response to that stress. So in this case, the fascia is over thickened. The other piece I mentioned is plantar fasciosis. So that's a whole different thing. And what happens with that is that the blood flow to that area is restricted. And now what happens is the tissue starts to degrade. So it's not an inflammatory process, but it's really a degrading of the tissue. They're very different things. And all the strategies that would work for plantar fasciitis actually would be irritating for plantar fasciosis. So for us, one of the ways that we know this is true with people, if they've done everything that everybody's ever told them to do for plantar fasciitis, using coal, doing the pop bottle, rolling it under their foot that's frozen, the stretching, all that sort of stuff, and it hasn't worked, it's probably because it was the right approach in response to the wrong thing. So the way we treat this, there are several strategies to go about this, but it's actually quite different than the approach for plantar fasciitis. So it's important to know the difference. Another possibility is that this nerve called the posterior tibial nerve, if it's irritated, it will present again with the same sort of symptoms. And again, the traditional approaches for plantar fasciitis will actually probably irritate this, not help it. And that will be enormously frustrating, again, for the client, because they feel like, I'm doing everything right. Why is the problem getting worse, not better? So anyway, I hope this is helpful for you. Part of when you come in and one of my staff is looking at this at BodyWork Associates, what we'll do is we'll try to ascertain of these three, which is the most likely scenario, and then treat for that. And for us, it's all about results. We want to see in just 3 or 4 sessions some clear movement in the right direction that helps us know, yep, we're on the right track, and that will clarify what you need to do at home as well. So I hope you found this helpful. Thank you so much for your patronage at BodyWork Associates here in Champaign, Illinois. Thank you so much.